Tandem Plus is a multivitamin and iron product that is used to treat or prevent vitamin deficiency caused by a poor diet, certain illnesses, or during pregnancy. Vitamins and iron are essential for maintaining good health and are important building blocks for the body. It is recommended to take Tandem Plus as directed by your healthcare professional. Typically, the daily dosage is 1 tablet per day, and it is best to take it at the same time each day to help ensure consistent levels in your body. Taking Tandem Plus with a meal can help with absorption and reduce the risk of stomach upset. Be sure to follow your healthcare professional's instructions for the best results. When taking Tandem Plus, it's important to follow the directions given to you by your doctor or pharmacist. Typically, this medication is taken by mouth once daily, either on an empty stomach 1 hour before or 2 hours after meals. It's best to take it with a full glass of water, unless directed otherwise by your doctor. If you experience stomach upset, you can take Tandem Plus with food. However, it's important to avoid antacids, dairy products, tea, or coffee within 2 hours before or after taking this medication, as they may decrease its effectiveness. If you are taking the delayed-release form or extended-release capsules, be sure to swallow them whole and do not crush or chew them. It's also important to take this medication at the same time each day in order to get the most benefit from it. If you have any questions about the best way to take Tandem Plus, consult with your doctor or pharmacist for more details. Some common side effects of taking Tandem Plus include constipation, diarrhea, or an upset stomach. These side effects are usually temporary and may go away as your body gets used to the medication. If these effects persist or worsen, it's important to contact your doctor or pharmacist. You may also notice that your stools turn black while taking Tandem Plus, but this is a harmless effect caused by the iron in the medication. It's important to remember that if your doctor has prescribed Tandem Plus, they have determined that the benefits outweigh the potential side effects. Serious allergic reactions to this medication are rare, but if you experience symptoms such as rash, swelling, severe dizziness, or difficulty breathing, seek medical help immediately. This is not a complete list of possible side effects, so if you experience any other effects not mentioned here, be sure to contact your doctor or pharmacist. In the U.S., you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Accidental overdose of iron-containing products is a leading cause of fatal poisoning in children under 6. It's important to keep Tandem Plus out of reach of children. If overdose does occur, seek medical help immediately or call a poison control center. Always follow the recommended dosage of Tandem Plus to avoid any potential risks. Before taking Tandem Plus, it's important to let your doctor or pharmacist know if you have any allergies to its ingredients or any other allergies. This product may contain inactive ingredients that could cause allergic reactions or other issues, so be sure to discuss this with your pharmacist. It's also important to share your medical history with your doctor or pharmacist, especially if you have iron overload disorder, a history of alcohol use or abuse, liver problems, or stomach/intestinal problems. If your multivitamin contains folic acid, it's important to inform your doctor or pharmacist if you have a vitamin B12 deficiency before taking it. Folic acid may affect certain lab tests for vitamin B12 deficiency without treating this anemia, and untreated vitamin B12 deficiency can lead to serious nerve problems. Be sure to consult your doctor or pharmacist for more details. Before undergoing surgery, it's crucial to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to inform your doctor before using Tandem Plus, as well as consulting your doctor before breastfeeding while using this medication. The use of Tandem Plus may affect the way other medications work or increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not make any changes to your medication dosage without your doctor's approval. Tandem Plus may decrease the absorption of other drugs such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's best to take these medications as far apart from Tandem Plus as possible. Ask your doctor or pharmacist for guidance on how long you should wait between doses and for help finding a dosing schedule that works with all your medications. If your multivitamin contains folic acid, let your doctor or pharmacist know if you are taking certain anti-seizure drugs. It's important to note that Tandem Plus may interfere with certain lab tests, which could lead to false results. Make sure all healthcare professionals are aware of your use of this medication. If someone has taken too much Tandem Plus and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local poison control center at 1-800-222-1222, while residents of Canada can call a provincial poison control center. Symptoms of an overdose of Tandem Plus may include stomach pain, nausea, vomiting, and diarrhea. If your doctor has prescribed Tandem Plus, it's important not to share it with others. Make sure to keep all your medical and lab appointments as directed by your doctor. Some brands of Tandem Plus may also contain ingredients such as docusate. If you have any questions about the ingredients in your specific brand, be sure to ask your doctor or pharmacist. It's important to remember that Tandem Plus is not a substitute for a proper diet. It's best to get your vitamins and minerals from healthy foods, so be sure to maintain a well-balanced diet and follow any dietary guidelines provided by your doctor. If you are taking Tandem Plus on a prescribed schedule and miss a dose, take it as soon as you remember. If it is near the time of the next dose, skip the missed dose. Take your next dose at the regular time. Do not double the dose to catch up. Remember to always follow your healthcare provider's instructions for the best results. It's important to store Tandem Plus at room temperature, away from light and moisture. Avoid storing it in the bathroom, and make sure to keep it out of reach of children and pets. When it comes to getting rid of Tandem Plus, don't flush it down the toilet or pour it into a drain unless you've been specifically told to do so. Instead, properly discard the product when it's expired or you no longer need it. Your pharmacist or local waste disposal company can provide guidance on the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.